Well, all that sounds pretty good. Let's bring in our panel today, Martin McCary is director of the Johns Hopkins Center for Surgical Outcomes Research, Representative Michael Burgess. He is a medical doctor and chairman of the Congressional Health Care Caucus, which is a Republican group, and Bill Salmon is here as well. Representative Burgess, let me start with you.
Yes.
How, when you look at some of the ways to pay for these things, how likely is it that we're going to see these tax hikes to pay for this health care plan?
Well, I think what you're seeing right now, and it is terribly interesting, here at the 11th hour, we suddenly get concerned about how we are going to pay for these programs. Remember, all last fall and even during the spring and the latter part of the spring, all we heard about was new programs. Now the question comes, how are you going to pay for these new programs? And it's starting, frankly, to get a little bit ugly. The Pepsi tax, that might be one way. The employer tax, I don't know that like what you have, you can keep it. Well, I would submit that those two premises are very, very difficult to reconcile. And more along the point is, if you like what you have, you can keep it, right up until the time we tell you that you can't. And it appears that today we're finally peeling the onion back a little bit, pulling the curtain back a little bit. And indeed, it will be very, very difficult to keep what you have if you want it.
Yeah, Bill Salmon, I know you've been following all this very closely from our Washington bureau. One of the questions in my mind is, it says, well, small businesses wouldn't be forced necessarily to cover their employees. So a lot of small businesses out there, which make up, the largest employment pool in our country, a lot of them already cover their employees. But what's to stop them from, bailing out of the plan they have if it's very expensive and saying, go get your plan for the government, and then don't you have a trickle effect that leads to people not getting to keep the plan they have and like?
The health care reform legislation, and yet they're so influential that they may be the undoing of that legislation, because they are not going to stand by and let their union members see their health bennies turn into taxable income. That would be another concession that the unions have to give back in this recession. So Obama's health care reform initiative is facing opposition from both parties, and just in the last couple of days, it's now starting to look like this might not happen. It looks like the whole plan is on the ropes. Previously, it looked like it was going to get done by the end of summer. Right. Now all bets are off.
Let's ask Dr. Martin McCary, who is a doctor who we talk to frequently about health issues, but today we want to talk to you about the president's health plan. Do you hope it happens, or do you hope it doesn't happen?
Well, I got to be honest with you, Martha. I have really come around as a doctor. When I've seen people suffering and they need an elective operation, a cancer operation, or key medical procedures that could prevent bigger bills, I really have come around to believe that health care is a fundamental right. And just like we say every person in America is entitled to a lawyer if they commit a crime, they're entitled to a doctor if they get sick.
But Dr. McCary, why not? Let me ask you this. Why do you think this wouldn't work, which is an alternative plan that would basically give people their own medical savings account, right? You get $5,000 for a family, $2,200 for individuals, that goes toward money that you probably would have to throw in some of your own as well, where you get to kind of shop.
Doctor, and there's all kinds of denials, preconditions, catastrophic caps, and lately a lot of insurance companies have been going back to your application saying you made a mistake, you dated it wrong, or you had a pre-existing condition you didn't tell us about, we're going to deny your entire payment. There's all kinds of dirty tricks out there, and we don't have those tricks.
Yeah, but I guess the question is the government better to manage that, or is it better to have your own personal health insurance account? And in that case, a pre-existing condition would not be an issue, because when you switch job to job, you would still have your personal your personal insurance account.
That's reasonable, but I can tell you right now, ask any doctor if they'd rather take a Medicare patient or a patient with private HMO coverage, and they'll pick Medicare.
And they know they're
brought my
going to get paid.
Medicare. He's a doctor.
Maybe
We're
that's
doing
where
some
he is
surgical
today.
training. That's where he is. That is exactly
Thank you, Dr.
where he is.
McCary. Representative Burgess, did you want to say
Thanks,
one quick thing
Martha.
before we go?
Well, on the Medicare issue,
Yeah.
and what Dr. McCary says is correct. On the other hand, doctors across the country are facing a 30% cut in their Medicare reimbursement rates this December if Congress does not do something. This happens every year. Here's the problem. If you go to an expanded Medicare or Medicaid, the easiest lever to pull when you want to do cost containment is to ratchet down provider reimbursements. And unfortunately, the Congress has shown a great willingness to participate in that over the years. So therein is the difficulty. Again, many Medicare patients that I saw would complain to me that it is very difficult to find a new doctor if you're a new Medicare patient coming into the community. It has become a serious problem from the provider community, and as a consequence, that has to be fixed. If we're going to hand her over to the government, aren't we at least obligated to get this right before we do that?
And boy, don't you want good people to want to enter the medical profession and to serve it, in an honorable way, as both of you gentlemen have. Dr. Michael Burgess, thank you. Dr. Martin McCary, thank you as always. And Bill Salmon, you and I are the ones without medical degrees here. Thank you very much, Bill, as always.
But Dr. Gallagher.